Okay, let's get started. Thanks for everyone to join our second webinar, Journey as a U.S. Emergency Medicine Doctor. I'm Joseph, and I'll be today's moderator.
Ok, entonces ahora
We are thrilled to have Dr. Eric Chou with
eh,
us.
puede ser.
So, so this session will be more of a conversation than a formal lecture. So if you have any questions, please feel free to jump in at any time, either using your audio or drop your question in the chat. And this event will be recorded and will be uploaded to our YouTube channel afterward in case any one of you would like to rewatch it. So please allow me to introduce Eric. So Eric, can you hear me?
Yes.
Great. So Eric has a this remarkable career in emergency medicine. He received his MD degree from Chung Shan Medical University and completed his EM residency at National Taiwan University Hospital, where he later served as an attending physician. After working as an attending physician for a few years, he decided to pursue a secondary residency in emergency medicine at Maimonides Medical Center in New York, followed by a fellowship in emergency ultrasound in Fort Worth, Texas. Today, Eric practices at Baylor Scott White Medical Center in Dallas as an attending physician in emergency medicine, where he also does ultrasound director, research director, and worked as one of the core faculty members of the EM residency program there. So Eric has been trained and practiced in both Taiwan and the United States. He offers unique insights into the similarities and differences between these two healthcare systems. So I'm sure that he will have a lot of great things to share today. So please join me in giving a warm welcome to Eric.
Uh, Thank you, Joseph. Thank you, guys. My name is Eric Chou. Um, I really don't think my career is remarkable. So I think I'm lucky to be who I am today. I'm glad you guys invite me to share my experience about that. Um, I know we have so many like Taiwanese student. We may have some like foreign like students. So that's why I think we are using the like English version for this conference. If you have any question, you can let me know, and then we can definitely talk in Mandarin. It's totally fine. So my name is Eric Chu. So 我的中文名字叫周浩昌。It's very interesting to introduce myself. So I was born and raised in Taiwan. So I finished my medical school in Zhongshan 医学大学 in Taichung. I'm lucky to have my internship in National Taiwan University Hospital. I learned a lot from there. I choose my first EM residency there. I finished my residency. I became the attending physician over there. And then I moved to New York. I started my second year residency at Maimonides Medical Center in Brooklyn. After that, I moved to Fort Worth, like Dallas Fort Worth area. I finished my emergency ultrasound fellowship, and after that, I'm kind of doing the director of ultrasound and research. So now my main job basically is more like I'm doing ultrasound, I'm doing research, I'm doing some clinical work. So I have maybe like 30% my like hours for the clinical and like maybe 70% for the admin and teaching. So I'm glad to be here and then share this experience with you. So if you are interested about EM, if you are interested about the US, like either residency or just the physician style or the environment, and then I can answer all the questions you have. Thank you.
Great. That's I've a I've collected the response questions from our Google form. So let's get started with the basics. Like, what originally drew you to emergency medicine?
Mm, I think when I was a medical student, I think I like majority of use. We don't know like which specialty is good for us, so we try to learn from our internship and from the clinical practice, and also we kind of just gather information from different people. So for me, the reason I choose emergency medicine, I think is mainly on the lifestyle. I really like the lifestyle. You can have um the very fixed limit, like very fixed period of time you can focus on your patient. When you sign out to your colleague and you don't have to worry about your patient, and then you can just like totally off. So I feel like I can have more time for myself, and then I don't have to be on call. I don't have to be worried about this kind of thing. But it's interesting because when I was attending, I feel like it's kind of different thing because it's not like what I thought before. But anyway, I like the lifestyle. You can be totally on, totally off, and you don't have to worry about your patient when you are away. You can have the different lifestyle. You can even have the secondary career. That is a good thing. So I think you probably know you can be the emergency physician, but you can also be maybe you can be the different like for example, you can be a YouTuber, you can be the artist, you can be the like an educator. You can do so many different things because you can arrange your shift together, and you can arrange your days off together. That's kind of good thing and bad thing. But I like this kind of style. I like to focus on my patient, and then I can totally use my time efficiently. I don't like to waste my time or just like spend a lot of time in the hospital. So that's kind of it's kind of the idea like why I choose emergency medicine. But when I became the resident, I feel like it's interesting because I think we have to do like maybe 18 to 20 shift when you were the EM resident. So you spend lots of time in the hospital, and then you have to do lots of like research, or you have to do lots of like reading or like conference. So it's not just about the lifestyle anymore, it's about your passion. So I know there are lots of people, they kind of like question themselves, like, do I have to continue my specialty? I know in Taiwan, they kind of talk about the cosmetic medicine. They like to do this kind of thing because they feel like they can have the easier life, they can make more money, which may or may not be true. My thought process just like, if I choose this specialty, I really want to. So I'm lucky, I do have the interest, and I think I'm very good at it. So I think just the passion just like guide me to like I know where I am right now. So I'm very lucky to have very good mentor. They have so many good doctor in National Taiwan University Hospital, 台大医院. So even now, I'm still learning from my mentor. So I appreciate that. So I thought about that. I may have a different career if I choose different specialty. But I'm glad I choose EN. I think if I want to give it a short answer, I think the lifestyle, and I think just also the passion to the medicine.
Great. So let's go to the next part. So I guess the audience would be quite curious as why you decided to, like, after the whole training and practicing as attending in Taiwan, what makes you to decide to retrain in the States?
Yeah, so I know we have many student or resident here. So that's a very good question you have to ask yourself, because when you spend lots of time to study medicine, I think everybody like spend like 7 years to your med school, and then another maybe 3 4 years in your residency. When you are studying, working on it, honestly, you haven't thought about like what your career is and then what's your goal. So when I was a resident in Taiwan, honestly, I didn't think about that too much. I just feel like I have to do my shift. I have to take care of my patient. I have to finish my chart. I have to do the lecture, and then I have to do lots of research in Taida. So I didn't really think about that much. But when you became the second year or third year, or even when you become the chief resident, when you kind of know more about the, I would say, kind of medical, like hospital environment, you try to figure out like what you really want to do. Like it's not just about being a doctor. It's not just about making money. It's not just about like paying your mortgage. Just like something you really want to experience. So in Taida, people tend to do like maybe it's kind of short period of time. You can get some like funding either from the hospital or from the government. You can have maybe 1 or 2 years. You can go to the U.S. or you can go to different like foreign country. You can have this kind of it's kind of exchange experience. You can learn something. You can learn from different researcher. You can learn from different lab. You can learn from different like experience. And then they want you to have this kind of training and bring this experience back to Taiwan to help the hospital. So we have so many I would say like my friend, my colleague, or my mentor. They went to the U.S. And then they got either the master degree. I would say, yeah, like master degree of public health, or they got the PhD degree, or they went to the biggest lab, like for example, like what was that? From Harvard or from MGH. They got biggest hospital, and then they got this kind of research like result, and then they bring the whole like research or technique back to Taiwan. So at that moment, I was thinking just I probably have to follow the pathway, because in Taiwan, when people recognize you as the good doctor, it's not just about your clinical like practice, it's about your research. It's about your title. You want to be the professor. You want to be the PhD. That's why so many people that try to be a PhD. So many people want to do research. I think I don't really want to do that. Doesn't mean I don't like research. I just feel like I like clinical practice. I think there's something else I can learn. So we have some friends. They after they graduate from their residency. I use graduation, like they graduate from the residency and then they become the attending. Some people just try to make more money. Some people try to go to the US to get the degree. So I want to try something different, just like maybe I can go to the US to learn some clinical practice. And then I kind of talk to many people. Initially, I don't even know that will work because I don't have any visa. I don't have anything. So I don't even know if I can apply for the residency. And then I got more information from the internet. I kind of realized I can apply for the residency. I can go there to become the U.S. doctor. That would be the life changer, because it changed my career, and then it kind of opened the door. I may have more opportunity to practice medicine either in the US or other country like Australia or even Canada. So that made me feel like, you know what, if I can spend like next maybe 3-5 years, do I want to have the degree, or I want to have another like I can say passport, another pass to different career opportunity. So, but that is a big decision, because I don't really know like if that is possible, and I don't even know like what was the odds. Anyway, so um I kind of struggle a little bit about that thought, because at that moment I don't think my English is that good. I know now for the younger generation everybody can have very good spoken English, but at the moment honestly I don't think so. I feel like I'm okay about talking to my patient in English, but not very good. So I kind of struggle a little bit, and then I kind of struggle with my ability. I kind of struggle with my family, also my financial like support. But I don't know. I just feel like if I don't do that, um, I may regret about my decision. I may regret I didn't go. So that's why I talked to my parents. I talked to my I think she's my girlfriend or my wife. Anyway, so I kind of decide I want to give a try. If I cannot do it, it's totally fine because I can still have my job in Taiwan. But if I can do it, that'll be the different world to me. So that's why I make the decision to go. I started my studying and I started my plan when I was my I think it's maybe third year. I'm lucky to know so many different friends from Taida and Yangming. So we have the small group. Like it's kind of like it's studying group. So uh, they are so talented. So they kind of teach me how to get the information and then how to prepare for the USMLE. So I'm very, very lucky because at that moment I don't really remember like what is my biochemistry or whatever TCA cycle stuff. Anyway, so I spend time to study, and then I'm glad I got this kind of step one, step two, and then I kind of follow the path, and I got matched in the end. It's a very tough journey if I really think about that. So in the beginning, I didn't know that would be that hard. I thought I can definitely have something because I'm very confident, in my research and my like EM background. But um, when I start my application, when I start the whole interview season, I feel like that's a totally different thing, and it gave me a little bit, like I would say it's a big shocking, like experience about that. So, but anyway, I'm glad I made it. And then it's kind of make like who I am right now.
I'm just curious, was the study group all are they all like young graduates, or are there any like graduates with higher YLG?
Oh, I think it's kind of mixed, but majority of them they are just like recent graduate, or even they are just the medical student. So I think the majority of our group matched. Now they are the physician from clinical Cleveland Clinic. They got the I think that there are somebody somebody is a professor, not professor, assistant professor from Emory. Some people have got a professor like assistant professor from UW. So almost everybody got good, like outcome. So we are very proud of this. So we got group in Facebook. So we try to help our student to understand like how to prepare for the exam, how to prepare for the match. So we have so many good like student. Yeah, I'm very happy for them.
So it kind of became a close circle where you fought together, like to went through the struggles and come to the States and achieve your dreams.
I think they are the reason I'm who I am right now, because in the beginning, when you are just one person just like studying alone, you don't even know if that is sustainable, because just so many different voices. I remember when I was asking my mentor to write the letter of the recommendation for me, and then my mentor just like, okay, you know what,
Okay, you know what?
you may ask somebody else. I know the physician in Harvard, and maybe they can help you. Or I have a very good friend. He's an emerging medicine physician in the U.S. Maybe they can help you. And then so I try to reach out to different doctors to help me. But in this, I would say there are lots of people. They'll give you the um, I cannot say they are wrong, but they will just say, I don't really think you can get matched because you are too old, or you don't have any visa, and then emergency medicine is very competitive.
Did
So
someone actually said that to you?
yes, because I have the I really don't know how to if I need to say that, but I do have a yeah, it's kind of my mentor, and then he told me just like I don't think you can make it because um it's just too many barriers. It's just very, very hard. So people try to convince me maybe you can do something else. You can do research. You can do whatever. Or maybe you can be a nurse first or whatever stuff. Just like you can apply for a nurse. Just like something else. They just like I don't think you can be the doctor in the U.S. just based on what you have. Like what you said, you gotta like just you are not fresh medical graduate, and then I didn't have a good score, by the way. So I do have some research, but usually don't care about research. In medicine they kind of more they kind of focus on if you have any US clinical experience, USCE. So I don't, and I don't have any letter of recommendation. We call it SLO, like standard letter of evaluation. This kind of very specific form coming from the program director. So I don't have anything. Honestly, I have nothing. So I really don't know. Like that is the big issue. I thought my experience or my research would be the big like strength. But from the program director in the US, that may not be the case. So it's interesting to look back to see like how naive I was, but it was a very interesting like like journey, initially like you don't even know, and then people kind of give you different like I would say like advice, and then you don't know who to trust, you don't know what to do, and then all you can do just trust yourself, and then just pray for the best. So, but that's what it is, and then I'm glad I made it. Yeah.
Sorry, did you said when you apply for match, you didn't have enough letter of recommendations, or you don't have any US letter of recommendations?
Okay, so let me talk a little bit about the letter of recommendation. So if you want to apply for the US residency, basically you can have three, sometimes four letter of recommendation. So usually it's not that hard because you can ask your for example, you can ask your mentor, your whatever chair of department, you can ask the whatever the president of hospital. But what they can help you basically just give you the very generic like letter, just like you got you like the chat GPT. They can give you the letter like to tell people like how good you are. That is what I can do, and you can probably ask some other like American or Canadian doctor to write the letter for you because you may have some research collaboration. But what they can do is to give you the letter about you are the good guy, and then you are hardworking, or you got very good research experience, but they cannot really tell people like how good you are in the clinical practice. So every specialty may need different thing, but in the emergency medicine, they focus on your clinical ability. So that's why they create a very, I would say, formal and standardized letter of recommendation. So it's not just about like your performance, and it is about the percentile, and then you perform in your class. So because I do not have any a US clinical experience when I applied, because I didn't do anything when I was the medical student. So I don't have anything. So that's why my letter of recommendation basically is pretty superficial. Just about me, about my personality, about my research, but not really about my clinical work. And even I do have some letter talking about my clinical work, but this is Taiwan. So in the US, they don't think Taiwan and the US is the same, right? So that's why it's a little bit hard. And usually, if you don't have the standard we call SLO, if you don't have a SLO, you cannot even get selected to the interview section. You will get filtered out. Some program they will have different filter. For example, they can put the USMLE score. They will say, I only want to select the score more than 230. So if your score is not good enough, you probably cannot get it. So I think visa is a big barrier, and slow is a big barrier, and score is a big barrier. But I don't have a good score. It's very hard for me to get a good score, honestly, because I kind of just graduate kind of from medical school kind of too long. So technically, I don't have a good score, and then I don't have slow, and I don't have like USCE, and then I have some research, and I'm good looking. It's kind of the only thing. I'm sorry, just joking. So I feel like it's very hard. It's very hard to get in. So yeah, it's kind of question. It's kind of answer for you.
Okay, thanks. So I saw from your Facebook page that you worked first as a research fellowship when you first came to New York. Does that introduce you to more like potential USCE, or you like did you apply for any like externship or observerships in the States?
Yeah, it's a good question. So I think right now our audience probably will ask, just hey Eric, you keep saying that you didn't have anything, but how you got matched, right? So that's kind of something I want to share with you guys. Yes, if we can have the checklist to get matched, your score, your letter of recommendation, your US clinical experience, and your visa, whatever stuff. Yes, if you can have more items like checked, it can increase your chance. But sometimes you don't. Sometimes you don't. So my pathway is a little bit different. I know some other doctor may have the same thing, just like I don't have this kind of thing, but I have to create something can help me to get matched. So the major thing is connection. I'm not saying that the connection from the back door or whatever stuff, just like connection to let people know you, because the most important thing is that your interview, because when they set up so many like filter, they try to select the best person, the best people to their program. But the thing is like if you don't have this kind of items from your checklist, you cannot get selected. You got filtered out from the system. It's not your fault. You just cannot. So the only way, just like okay, you have to let people know you. So that's why I spend lots of time to figure out what can I create this kind of thing. That's why I told you like I talked to my mentor, because my mentor, Dr. Matthew Mott, he's a very well-known like almost a like world-class level researcher. So I try to ask him, do you know any like, for example, the chairman of the emergency department or any good researcher he can help me to write a letter for me, or I can have any like good connection. I can visit their emergency department, and maybe they can know me, and then they can help me. So I'm lucky because I do know one emergency physician. The name is Matthew Chen. So he's kind of one of my best friends as well. So he is the attending physician in Maimonides Medical Center in Brooklyn, New York. So I know him, and then so he invited me to go to their department because he is the ultrasound faculty. So when I was in Taiwan, so I did my first research about ultrasound. So I'm very good about ultrasound and ultrasound research. I published my first research article about the trachea ultrasound. I present my research in the national conferences. Anyway, so this article has been pretty famous in the EM world. So when Matt just like invited me to his department, everybody knows about me. It's not because of me, it's because my work. So I present my research over there, and then I spend 2 weeks over there just to join their meeting and then join their clinical shift. So it's interesting. I think it's a very interesting coincidence because Maimonides Medical Center basically is a very big like hospital in Brooklyn, just right next to their Chinatown. So they got a lot of Chinese patients. So they want to have more Chinese speaking doctor. So I'm very like, I feel like I'm very welcome there when I was there. And then because my research, because my ultrasound background, and then they really like this because their chairman, I think their vice chairman is a big fans of ultrasound. So that's why he likes me a lot. So their program accept IMG as well. So that's why they asked me just like, okay, do you want to stay and then maybe you can help us about research, and then I know you're interested about staying in the U.S. and maybe we can help you as well. So that's why I stayed there for they gave me the title just like the research fellow, and then I got my first visa, H1 visa. And then I think what they try to do, just like, I think this guy's good. This guy, I want to give this guy a chance. I cannot guarantee you I'll give a spot, but maybe I can see, your ability. Maybe I can give a chance. So that's why I stay over there. I just moved to the US in I think it's 2013. It's a very challenging year because I feel like that I have to impress everybody, and then I have to, I have to do my best on research. Also, I have to do my best to apply for the residency. So I try. It's just interesting. Just like I know everybody over there, and then I work very hard like day and night, and I got interview from there, and then I remember when I was having the interview with their program director, the first question he asked me just like, why you want to be here? Why you want to come to the US? Why you want to redo your residency? So honestly, I prepared for that. I prepared the very good answer, like very just like ChatGPT, give it a very, very like strong answer for that. But he didn't believe it. And then my program director and I, we are very good friends right now. Honestly, he's my neighbor. It's interesting that he followed me to Texas. But anyway, he doesn't believe it. He's just like, why you want to come to the US like far away from your country? It doesn't make sense. And why you want to redo your residency again? And then anyway, then I passed the interview, and then I got matched. I just started my residency. So what I try to say is, I know sometimes, your odds may not be high, but the only way is you have to think about like what you really want to do. And if you really want to do something, I think sometimes everybody will help you. And then you may be lucky to achieve your goal. If you know like how to do it. Yeah.
That's very inspirational. So I guess I can learn from this story that, as you said, from ER's residency program's perspective, research might not attract them that much, but doing good research actually opens more door and can like be an upper hand for you to get to know more people, and in order to like probably get a potential USCE or letter of recommendations. Am I
Yes,
correct?
I would say yes. I would say if you are interested in internal medicine or pathology or neurology, I would say research is very, very important, because if you got very good research, when I say very good research, not just like, I know people like to do meta-analysis. I'm doing meta-analysis. I know people like to like make the whole list of your publication. But when I say research, just like you really have something, your passion on research. So you do something they can see from your CV. I'm not saying that I don't like meta-analysis, but the problem for meta-analysis is every time you do meta-analysis, you'll pick up different topic, right? Because you cannot focus on one topic. So I got a lot of meta-analysis in my publication, but the things like sometimes you pick up different topic from other people, they cannot see your interest. They feel like your interest is the meta-analysis, not the specific research topic. So I think that's important. For example, some people apply for the neurology. they have very good interest about migraine. And then their publication or their poster, everything just about migraine, headache.
拜不回家，
So this
先
kind of
连上
something
去，一边听一边回去。拜拜。
this kind of something you'll see. So when you establish this kind of research, I would say your CV or your career, you can show people about like your passion. People know your passion from your research. That's kind of most important thing. And then when you have this kind of connection, you can build up your like I would say it's kind of bridge to different either department or different researcher, like in the US or even different country. And then you can find different opportunity. But go back to your question. Yes, I think research is good. So research basically can help you to stand out, and research can help you to build out a connection. For the EN, I do have a couple good like I think student. They initially they do not have a lot of like opportunity, and then they came to my department, and then I think they did a research assistant, and then they can know more about the U.S. environment, and then they got good letter of recommendation, and then they have the U.S. clinical experience from their research work, and then they can have their CV like ready, and they got matched after that. So that is the that is the alternative way you can get in if you cannot have a lot of like checklist item.
Sorry, did you say that those students build their CV and done all their research in Taiwan without like physically being in the US?
No, I mean they came to the US, they came to my department, and then they kind of spent a year with me doing research, and then they because they have the publication, and also they got a let me go back a little bit. Okay, so when you are in the interview, people will ask you where you're from and why you come to the US and why you choose our specialty. So if everything you have just from Taiwan, people may not believe in you, just like why you want to come to the US, because everything from you is just from Taiwan. So that's why it is important you have something in the US. For example, I came here for whatever reason, maybe research, maybe degree, maybe whatever stuff. And when in the interview, when I talk to my interviewer, I would say, yes, I did a research fellow here, and then for a year, I really like here. I like the culture, I like the music, I like the food. My parents here, or my friends is here. So I want to stay in the US. That's why I want to apply for that. So that's why when you are having this kind of exposure or this kind of work experience or volunteer experience or research experience in the US, they will feel like, yeah, you really like this place. It's not just like, everything from you just from Taiwan, and then you just want to come here to get a job. Again, it depends on like your credential. If you say, oh, I got very good score, I got very good publication from Taiwan, and then I'm the US citizen, or I got a visa, or I got whatever stuff, you don't have to worry about it, because you are a very good candidate. But if you don't have all of them, you just have to have something else. Especially, you have to make sure people trust you, like, oh, you really want to come here. And then because from the program director standpoint, they don't want to match you, and then after a couple of months, and then you say, you know what, I don't like US, I want to go back. So that's why they want to make sure, you'll be here, you'll be happy here, and then I want to help you to be a US a doctor. And after that, you want to stay in the US to help our people, not just like you come here and then you go home, right? It just doesn't make sense. So from a program director standpoint, I think they focus on that a lot. So that's kind of something where you have to prove that. Yeah.
That reminds me of there's an upper class in NTU, like I remember he mentioned that like there's a system where you can upload all your data, right? I forgot, it's called ECFMG or something. Like basically there's a section that you can fill your interests, like your hobbies, your stuff, what things you like. He said that during his interview, like emergency medicine residency interviews, they ask every single one of his hobbies fill on there. He was very surprised, but that was when he realized that your interests really matter. Like he feels something like doing volunteering, like cooking, hiking, some sort of that. And he didn't realize at that time that those seems trivial things are so important.
The reason it's important, because I'm the faculty, I'm the teaching faculty in our department, so we have to interview our applicants. So I don't know if we will touch the topic later, but I can give the idea, because we are helping our student to prepare for the interview. So in the interview, they knows about your score, they knows about your publication, they knows about your background, but they don't know you. They don't know you because everything is on the paper. They want to know you, your personality, what you like. Are you humble enough to learn? Do you have any red flag? This kind of something we want to know because we are choosing the resident who will be working with us in the next 3 or 4 years. We don't want to get in trouble. We don't want you to be not happy. You know, we want you to enjoy this environment. So that's why sometimes we feel like, for example, like if you come to Texas, but your parents, they are not in Texas. Your parents is in Boston, and then everything about you is in Boston. We will ask why you want to come to Texas. You know, just it's a very straightforward question, right? Just like, okay, you came from Taiwan. They may be interested, like why you want to come to US? Because I think Taiwan is a very good country. Taiwan is a very good place to practice medicine. You guys have the best, healthcare system in the world. Why you want to come to the US? They don't know you. They don't know, and that's why they want to ask. That's why it's important to see you, to talk to you, not just looking at your record. So you are right. The hobby, because hobby sometimes when I teach my student, when you say I like basketball, it's not just like I like basketball. You show your passion about basketball, and then that could be the big plus for you. And then you can say I'm the captain of my my high school basketball team. I think the reason Jeremy Lin can get in Harvard is not just about his academic score. It's about he's a basketball captain. So he's in high school, because in the US, when you are the captain in a sport team, it shows your leadership. So that's very important. That's kind of something we do not know. We don't even know. I thought in Taiwan, just people just focus on the studying. Why we have to worry about basketball? But in the US, when we talk about your interest, your hobby, it kind of show who you are, and that's kind of important. If they want to pick you, it's very important.
Yeah, that makes sense. So about the CV, like you've already been can I say PI or like faculties for several years. So the audience is quite want to know that how to build a competitive CV, like from your perspective as a faculty member, what kind of CV stands out among the others, and like also how to like win a strong letter of recommendation during your USC. Could you share your thoughts on that?
If you want to apply for the US residency, so honestly, you don't have to worry about that too much. The reason is, first, you need to have a good score. The good thing is, I think for our student, our medical student, I mean, you guys are so smart, so I believe you can have very good scores. So I'm not worried about that too much. And then you have to follow their, I'll say, their rule, just like a game, For example, in the US, if it's not about just your score. They want to know your experience. So they have 3 different like major experience. The first one is, yes, your research experience. I'm not saying that you need a publication. Yes, you can have publication, but publication, poster, whatever project, you can definitely do it. And honestly, I believe many of our medical students right now, they have very good publication because in Taiwan, everybody kind of focuses on publication right now. So publication is important. It doesn't mean you have to have 10. I would say you have something to show your interest. Okay, maybe one may not be enough. I would say it should be easy to get more than one. Okay, so you got a couple, I think it's fine. Okay, you got 30, yes, it's very impressive. I would say the majority of people, because you are competing with other medical students. If you are talking about you are applying for dermatology, you are applying for neurosurgery, yes, you probably need a lot. But I would say in general, I would say it should be okay. You just focus on what you are doing. Use your get a good use about your summer vacation. You can follow your the mentor in your medical school or even hospital. You can easily get a poster. You can easily get publication. Sometimes you don't even have to be the first author. Just let you know. Okay, so that part, yes, it's important, but you don't have to be a freak out. Just not that bad. Okay. The hard part is your work experience. Work experience, volunteer experience, usually we don't have a lot. Or you don't even know how to put it in your package. Because most of our medical student, you just focus on your study or your research. But in the US, some people got so many different work experience because usually they do they go to a college, and then after college they apply for the medical school. It's kind of postgraduate, right? That's why some applicants they probably did like paramedics for a couple of years. They probably did like different like either research or like clinical work. Maybe we call it. Some people get scribe. I don't know if you know scribe. People just the scribe basically is they kind of doing your chart. While the physician is seeing patient. So they have different exposure, different work experience, and which we do not really have because in Taiwan everybody got good parents. To pay for your tuition, and everybody's kind of focused on your study. Your research or your romantics. So you don't have time to do this kind of thing with volunteering. But in the US, everybody will do a lot of volunteering or work. So that is a big difference. It doesn't mean you need a lot, but you probably have to package a little bit, and then if you have any question, I can teach you how to do it. But it's kind of something we don't have a lot. And also the US experience, there's a clinical experience, there's a totally different thing. You probably need a student exchange when you are the medical student, and then you can go to the US whatever hospital department. You can have some exposure, and they can write a letter of recommendation for you. So we talk about letter of recommendation. Again, everything based on your performance. There are different level of letter of recommendation. The basic level, just like somebody, they may not know you well, you may not know them well, but because the title, they write the letter for you. The letter basically is very superficial, just kind of telling people like how good you are. You are a smart guy, you're hardworking, blah blah. But I didn't touch any detail about like why you are smart, why you are good, why you are hardworking. So the higher level, just like okay, so they may not have the big title, but they know you very well. They can tell people why you are working hard. Why you're hardworking and why you are smart and why you are like outstanding. Anyway, and next higher level is they are the program director or associate program director. They know about the system. They even know each other. Just like, okay, I know this guy, and then this guy is a very good doctor. This guy's a very good program director, and I would trust every letter of recommendation he wrote. This kind of thing is a higher one. And so if you can have the chance to either like shadowing or whatever stuff, you can have the letter of recommendation get a real high level or the good quality, of course, can increase your chance. But don't get me wrong, everything just is kind of a piece of puzzle, right? You have to get everything, and then to show people who you are to get into the interview. So everything, some program director, they will put every details every item, they'll give a different weight and different score. And in the end, they'll calculate a score. So just let you know, just like, it's not like, okay, I don't have research or I don't have whatever stuff. It's kind of screw me up. I don't think so. But the thing just like you probably have to prepare for everything to get in your interview, and then you can shine in your interview.
A quick question. I know that letters from the program directors, the PDs, are like among the top of the like the most valuable LRs. But like how do you, as a medical student, how do you approach a program director if you really want his or her letter?
So if you are still the medical student, the best way is to have the just you can ask your school, or you can even just like email to the I would say the hospital or department if they have the international like student like exchange program. And then you just have to be there to do the clinical like either clerkship like observership or like internship, this kind of stuff. You apply for it. I know Harvard. I know there are so many. I think Duke. I think there are lots of like like well-known hospital. They offer even Johns Hopkins. I think they offered this kind of opportunity. You can apply for it. You can apply for it through your school, or you can apply for it by yourself. I don't know about how much is it, but that is the opportunity. When you get there, I can guarantee you will have the opportunity to shadow or talk to their program director or associate program director. And then you have to do your best, to get opportunity to be closer to them, either clinical or whatever academic. For example, clinical, you can shadow them, you can join their round, or you can join their shift. And academic, they have a meeting. Sometimes they have a group discussion. They have a conference. You just have to show up. And then sometimes you can present a case. Sometimes you can present the lecture. And then you just have to do something to let them remember you. And then sometimes the rotation will be 2 weeks or 4 weeks. And after you left, you just have to remember, you have to keep the connection. You have to write a letter, whatever, like Christmas card, whatever stuff. And then when you have when you have the opportunity to go to the annual conferences, and then you have to say, oh, maybe I can meet you there, and then just try to build out the connection. So that is not that is not something we are used to do, because in Taiwan we like to just pass the test, or to get a higher score, and then we can apply. We don't have to build out this kind of connection. We don't have to build out this kind of thing, but that is very important if you want to have the good letter of recommendation. But the majority of people, what they do, just like they will go to the lab. They will go to the research. You join whatever is a big title or big like name of the researcher, and you join the lab, and then you can have the good performance when you are doing research. And then maybe the researcher or the PI, they know about you, they want to help you, and then they can introduce you to other maybe the teaching faculty, and then you can have the connection with that. I know we have so many students. They match like OBGYN, they match ophthalmologists, and because they're very good research, very good connection. That's kind of different route, because you have to build out your relationship from research. Yeah.
I know getting like those kind of opportunities are like in the most ideal situation, but have you ever heard of like USC provided from agencies? Like you pay a certain amount of money, and they will introduce you to like maybe some emergency EM physicians that you can directly shadow.
Yes, it's a lot. So, but people need to be careful about that, because I think you can definitely have some USC, they can write the letter for you. But like what I said, it's very hard to tell you if that is helpful, because it's more and more common, and people knows about that is not real. But they charge a lot. I know, I think I remember like Brigham Women, they have similar thing. I think there's maybe 1 week. I remember it's 1 week or 2 week, they charge you like $2,000. So of course it's a lot. So it is I would say if you don't have any other choices, that's kind of the idea. I know there are so many information from the website, so you can definitely take a look. But the thing just like you have to control your budget, and then you have to make sure it is solid. You have to I think you probably have to ask around to see what is the best resources. But my recommendation is, because right now we have so many, I can tell you we have so many like US, I would say Taiwanese US physician now, like almost like over like different state, different city. I know we have like what is that NETMA 北美校友会之类的. So we have so many good association they are helping our medical student to get opportunity. Even in our group, we have a trust group in Facebook. We have so many good physicians, and then they are in the like leadership position now. So try to find the people you trust, and then to see if they can provide opportunity from their like facility. That'll be the best, and then try to build up different connection from either research or clinical. If you still cannot get anything, of course, you talk about the agency may not be the bad idea, but just be careful about that.
How about USC from community hospitals versus from academic center?
To me, it doesn't matter. As long as you can have the opportunity, and as long as somebody can write the letter for you, and as long as I would say the letter is relevant, I don't think that's a big difference. Yes, that'll be better. Somebody can write a letter for you. It's kind of strong from a higher title. For example, like Donald Trump write a letter for you. I'm sorry. Okay,
That probably won't help now.
that won't help, by the way. But just like not Donald Trump, maybe Elon Musk. Okay, you won't help. Anyway,
Probably won't help either.
just like somebody like really good, and then like the chairman or the leadership can write a letter for you, and which is relevant to your application. That would be better. Honestly, the best person is the one who know you the best, or they are the leadership in the residency program, like program director or associate program director. That'll be better. Sometimes you try to get a letter from the chairman, and they don't even know you. They even want you to write a letter for yourself. Like they even want you to write a letter, and then they can just sign. So that's why there are so many people they don't think that is reliable. So that is a hard part.
Thanks. Okay, so the last bundle of questions before we entering the ER part, like there's an audience ask how to cope with the fear of potentially being unmatched, and advice for a year of graduation whose year of graduation is over 20 years. Like, is ER friendly to IMGs?
Like what I said, when I first came to the US, I have the H1 visa, and it's only for 1 year. So if I cannot get matched, I have to go back home, and then of course I don't want to go back. But at that moment, I don't have a lot of interviews, so I feel like it's just very hard. I cannot say it's a fear, I think it's about the preparation. You can always have the plan A and plan B, right? So what you can do, just like to make yourself more competitive. So but also you have to control your budget, and you have to control like I would say some people like, what, I really want to come to the US, I spend lots of time, and then I want to get matched. So I put every effort, on my score, on my research, on my whatever stuff. And if I cannot get matched, I feel like I don't know what to do. I feel like it's the end of the world. I don't really think so, because I think you will get something from what you have done. And then even you cannot get matched, you can still try the second year. You can still try, different specialty, whatever stuff. So sometimes you don't even have to be, the doctor. You can try different, like, like I would say, some people say PA or even nurse, depending on like what you want to do. If you really want to come to the US to be the medical professional, I think either way you will get it, but just like depending on like what you really want to do. And I cannot tell you like everybody will get matched. Sometimes it's hard. I know there are some like student, asking me just like, I don't have a good score and I try, I didn't get matched. So like, what can I do? Should I get the USC or whatever stuff? I would say yes. You have to give you have to give yourself a limit. I will spend this amount of money or this amount of time to chase my dream. I give myself 2 years or 3 years, but if I cannot do it, the worst scenario, I probably just go back. I can still have a good life in Taiwan. I'm not worried about it. Taiwan is a good country. I'm not worried about it. But the problem is not about that. The problem is there are so many people. They are not sure about leaving Taiwan or come to the US. They don't know. They just feel like, you know what? I just take a look. And then if I'm lucky, I can get in. If I'm not lucky, maybe I can go back. So if you want to just like give a try, it may not work. Just like it's not just give it a try, just like you have to give you all to that try. That is more important, just like I know there are so many people that come to the US for the PhD or whatever degree. They want to stay in the US, they want to find a job. They apply for Google, they could apply for the Apple, they cannot get it, and then they lost their visa, they had to go back to Taiwan. And then they tried so hard to stay in the US. I know everybody knows about the story. So if you really want to come to the US, I would say if you made your mind, you just have to give it all, just have to give it all. You just have to try your best. If you cannot do it, it's fine. It's still a good journey, because, when you look back, I try and then I didn't get it, but
still a great turnout.
I still have my life, a good life. My friend, my parents in Taiwan, so I didn't lose anything, So it's just a different opportunity.
Would you mind break down the price, like how much you have spent like this journey overall, and also
You mean the cost?
what's the most difficult part of the whole process?
I think the cost, I think the major one basically is your USMLE, because I believe, people have to spend like I believe, I don't know, maybe like 5K or even more, on the exam. And then you have to do the your flight ticket, because you have to do there's the step 2 CS. You have to do the it's kind of standardized patient encounter thing. And the whole travel, the whole like task cost, it could be more than 5K. I don't know about the price right now, but I think it should be more than that. And then you talk about you want to apply for different USCE. You want to stay in the US for the research or whatever, either fellowship, or you want to have the observership, this kind of thing, and everything kind of added up. So just like when you try to study abroad, you probably have to think about like you probably have to have like from maybe 10K to 100K, depending on like what kind of expense in your budget. But first, it's not cheap, so that's why before I came, I did some part-time job in Taiwan in PR to get some money. So I saw somebody say about more than 7K. Yeah, you're right. I think I think you have the budget from maybe 7K to 10K for the whole thing. If you want to stay in the US, you have to think about you have to like your house rental, you have to talk about your grocery, whatever stuff that you it could be more than that. I think it's kind of I would say it's kind of big cost.
Okay, great. Let's move to the ER training part. So, would you mind like do a compare and contrast of the Taiwan versus US emergency like medicine environments, and like what's the hardest, which year is like the hardest adjustment year and the cultural shock you've met when you start like practicing as a resident physician?
Yes. It's a very good question. So when I first start my residency in the US, I feel like everything just like so interesting, just like so new, because you are seeing different patient population. You see white, you see black, you see Hispanic people, just like you feel like just different language, different, I cannot say different disease. I think disease is very similar, but I think just like the way they manage could be a little bit different. You feel like everything is kind of so interesting. And I think in the US, I have to say, the US residency program, they have their own standard. So the training program basically, they are helping their resident. So they have so many things. For example, they have, of course, your shift, your conference, your simulation, and then your lecture, and then everything just very standardized. Even you may not be able to like see every disease, but their curriculum basically can help you kind of prepare you to be the competent doctor. In Taiwan, I'm not saying that we are not, because I think when I was in Taiwan, it's almost like, I don't know, it's a long time ago, almost 20 years ago. So I think in Taiwan we have very good like development in the past decade. But when I was a resident, we are more like the Japanese style, just like I learned from my teacher, I learned from my attending. And in Taiwan, I think we focus on research a lot. So sometimes we did a lot of things, just very narrow minded. Just like I see my patient, I have to dismount my patient. I have to take care of my patient, but I don't really know what I'm doing. I'm just doing what I'm doing. I don't even know if it's right or wrong. So we don't have a lot of like lecture or teaching about that. So we just like learn from doing. We make mistake. We learn from mistake. That is how it works, So, but in Taiwan, we definitely can have so many patients. Thanks for our government. We have plenty of patients you can see. That's very good. We have plenty of procedure. In the US, you may not need to see so many patients, For example, in Taiwan, you probably see like 30, 40 patients, but in the US, you probably see like 10 to 15. So of course, when you see more patients, you probably can learn more. But I think just like when you see more patients, it doesn't mean you have it doesn't mean you have a higher quality. You just have a higher quantity. So in the US, when you have time to spend with your patient, you probably can learn something from there or learn from your attending. So in the US, we have more time to be with our resident or our attending. So there are more feedback, there are more discussion, there are more teaching like in your shift. So that's a different thing. Just like in Taiwan, you just have to work. And then because I think Taiwan is more like the majority of ER is, we call the resident dependent, means if there's no resident in this ER, that will be a big impact. But in the US, there are lots of like ER or program, they don't rely on resident because they got good faculty or they got good clinical faculty to see the patient. But again, different ER may be different. I think the bigger ER, they may still need a resident, but I'm kind of giving the idea. Just in general, when I learn from that, I just feel like in the US, you got more time to learn, you got more time to discuss with your attending, you got more time to study so many different lecture, different thing, and then can make you more complete. And in Taiwan, I have to say, what I experienced is kind of when I was a resident. So right now could be different. In Taiwan, because you have a lot of like clinical loading, that's why you have to see lots of patients. So sometimes you miss this part of education. But I know because like Chang'an or Taida or Qimei or Tzu, I think there are so many good ER. So they have the program director. I think they try to learn something from the US, and they build out a very good curriculum, either ultrasound or research or different stuff. They have the good the feedback system. So now I think in Taiwan it's much better than what I had in the past. So I don't think that will be the big difference right now. But I think long story short, I think in the US, because they have the ACGME to control the whole quality of the program, that's why to them they have the standard. In Taiwan, just like different hospital, different department, they may have their own standard. So you just have to figure out like what is the best for you. But for the residency training, I think both I would say country or both places, I mean they have their good and bad depending on which one is your favorite. About the clinical environment of Taiwan, the hard part is because we have a lot of like holding bed. We have a lot of patient in the ER. So I think either the physical or mental burden will be a little bit higher. For example, I'm working in Taiwan, a shift. When my shift starts, I have to get a sign out from the prior physician, maybe 10 or 20 patient. And then I have to take care of the 10, 20 patient, and then I have to pick out a new patient. So to me, just like so many patients I have to deal with. But in the US, the good thing is we don't have a lot of like loading from there. And then in Taiwan, when the patient cannot be admitted or the patient is still in the ER, we have to take care of them. But in the US, when the patient got admitted, basically we have the hospitalists to take care of the patient, even the patient is still in ER. So that's why for me, just like I only focus on the patient, like maybe 5 to 10 active patient. But in Taiwan, basically I think the number is double or triple. And then sometimes you may have the real emergency, like you may have the cardiac arrest, you may have STEMI, ST elevation myocardial infarction, or you got stroke. So if you have so many patients, you have the emergency coming, of course, mentally it's a big burden about that. But that could be the good training for some people. But I think in the long run, of course, it's not healthy for the physician. So I think there's a big difference between the US and the Taiwan. Of course, we hope we can improve, the environment. That's why there's so many discussion about how can we help our healthcare system, especially the image medicine like environment.
Do you know how does the community programs look like in the US? Is the workload higher as we've seen in Taiwan?
Let me give you the example. So the hospital I'm working at is Baylor Scott White All Saints Medical Center. So we are the higher level medical center, and then we are the tertiary transfer center. I think our level is very similar to like 星光医院. So I think we are the community, like urban hospital, but it's kind of community hospital. So our volume is around like maybe 50K a year. So the hospital, just like five minutes from our hospital, there's a John Peter Smith Hospital. they are the county hospital, they are the community hospital, and they are just like, I think their volume is kind of double. And then they are just like maybe 长庚医院. So, but even that, we don't have so many holding back like Chang'an or Xinguang. So because I work in different hospital, like both hospital, and we talk about Baylor University Medical Center in Dallas. I work there as well. So their volume basically is very similar to Taida Yuan, but they don't have so many holding bed like Taida. So I didn't work at UT Southwestern, but at Parkland, but I got an interview over there, so I went over there. It's very similar, just like yes, sometimes you may have the holding bed, sometimes you may have this kind of ER boarding problem, but it's not as serious as Taiwan. So I would say if you go to the smaller hospital, like true community hospital, because I have the part-time job in Methodist South Lake. It's kind of just a community hospital. So the whole ER shift, like 12-hour shift, I may see like 5 patients only. And then the ER is always empty. So that's a very good quality of life. So in the US, you will see like different hospital setting, you will see different volume. And I work in the sometimes I like to work in the hospital or ER, not hospital, ER, just like closer to my house. So I work in the freestanding ER, like sometimes you see like 10 patients the whole shift. It's very good quality as well. Because in the US, we have different level of ER. You can have the freestanding ER, you can have the community hospital ER, you can have the like academic ER, university ER, so different level. And I'm lucky. I have the experience to work different hospital. That's a good the experience, as a ER doctor.
Do you feel like your intern year is smoother because you already have some experience in Taiwan, or you do feel like you have to relearn a lot of like procedures?
I think it's smoother and easier for me, yes, because I know about I know about how to approach the patient. I know about how to make the diagnosis. I know how to manage the patient. I'm not worried about procedure because I'm very good at procedure. So you're right. I mean, to me, I'm not learning new thing about my medical knowledge stuff. It's more like I feel like it's more like just like get used to the different culture. Because I would say before I came to the US, being the physician, I never came to the US before. Just I would say, yeah, I came to the US before for the conference, but not really like, like dealing with the patient or talking to the patient. That's why sometimes it's hard, especially my spoken English was not that good. Even now, I still have the accent, right? So some people ask me like, oh, like where you're from, whatever stuff. So that is a hard part because when you are an ER doctor, you have to earn the trust from your patient and in a very limited of time because they are not like well, and then they are sick, and then you are a doctor to help them, but they may not trust you. So maybe because your race or even your English. So that's why you have to let them know, just like, okay, you are listening to them, and then you care about them, and then you know what to do. So I think the past maybe like 10 years, what I learned like a lot from my like residency or from my clinical work, just how to communicate with my patient, how to explain what happened to my patient, how to comfort my patient, and then how to make the plan with my patient. So, for example, when people have chest pain here, when people have chest pain,
when they were working with pre-K to secondary school students, that the skills that students learned in the art discussions actually transfer.
Sorry, can someone? Thank you.
Sorry. So for example, when people come to the ER because of chest pain, and then I know I would say in the US or in Taiwan, everything's the same. You can do the EKG, and then you do the blood work, and then you will get a troponin to see if the patient got any acute coronary syndrome thing. But the thing just like, if the patient got acute coronary syndrome, how you help the patient to get a better care. If the result they are negative, how you explain to the patient to make sure they can safely discharge. So just different thing, and then you have to know about your resources. You have to know about their the patient's education or expectation, how you communicate with them, how can they get a follow-up, and then do they know what happened, or do they know when they should come back to the ER? This kind of thing just like rely on so many communication, and sometimes you have to discuss with patient just like, okay, you have a kidney stone, and then you got hydronephrosis, your kidney is swollen, and what does that mean? And how to treat it. So this kind of thing just like is easy when you are in Taiwan, because I feel like everybody kind of knows about that. But in the US, it may not be easy to explain to them like what happened. So this kind of is kind of big thing to me to learn, just like how to communicate. And but honestly, it's very interesting. Now I'm very good about that. So it's a good learning. It's a very good learning experience to me.
How about the procedure part? Is there any difference between the procedures you've learned from Taiwan versus those you've learned from US?
I think it's very similar. The thing just like in Taiwan, sometimes we have to do the procedure, sometimes by myself without my attending supervision, or I don't have the monitor, or I don't have lots of space. I think in the US definitely is better. You got more resources. You have more time to do it. You definitely got a monitor. You got more help from the nurses. I'm not saying that the nurse in Taiwan they didn't help you, just like they may not be able to help you because they are busy. Because in Taiwan everybody's busy, so you may not have time to do every procedure. But again, I think every hospital they have different setting. So I may be biased, but I would say when I was in Taiwan, I feel like if I want to do the lumbar puncture, if I want to do the central line, whatever stuff, sometimes I got a little bit occupied, just like I'm doing the central line, but also there's another patient, they are sick. I may want to intubate the patient, just like I feel like I'm very short-handed. So this is a little bit hard. I think in the US, I think this is kind of less stressful. You got more help, you got more like resources, this kind of safer environment for the physician.
Okay, so what makes you want to pursue fellowship? Is doing fellowship common for EM residents? Like what's your story behind it?
Oh, this is a good question. I can't give people about the idea. So in Taiwan, if you want to be the emergency physician, after you graduate from your residency, you probably just have to work clinically to make money. If you are lucky enough, if you are the chair of a department, or if you are some people say okay, like academic physician or research physician, your department will probably pay you a stipend, to support you to buy down your hour, but you still have to do the clinical work. But in my mind, just like sometimes for the department, we need people to invest their time either on the education or research or whatever technique, such as ultrasound. In the US, there's a big difference because, for example, if I were the ultrasound director, so I can get paid from there, and I don't have to work too many shifts. So if I were the research director or whatever EMS director, I got paid, and I got paid well. So I don't have to do so many like clinical work. I don't have to work so many hours. So give you a number about that. For example, if I give you the contract, everybody will make the same money. Like Taiwan, everybody give you the same amount of money. For example, I give you like 350K is your annual salary. I want you to work 120 hours. That is just for everybody. But if I want you to do research, I want you to be the director of research, I want you to be the director of ultrasound, I would say I still give you 350K a year. it's the same amount of money, but you only need to work 60 clinical hours. Because you have the other 60, you have to work on your research. You have to work on your education, whatever stuff. So that being said, I only need to work half of my clinical hours. Some people, for example, the program director, they will say, yes, you got 120 hours. I want you to work 80 hours. Sorry, I want you to focus on your education or your residency program. I give you 80 hours for that. So you only work 40 hours. So that's why sometimes people may not work a lot. For example, right now I work maybe like 6 or 7 shifts a month. I can still have the stable salary because I put my time on research or other stuff. In Taiwan, it's a little bit hard because everybody need to do research, everybody need to do education, so everybody's the same. So that's why I think the department they don't have to pay you more. So that's why you still have to work more. So that's a little bit hard. So in the US, basically you can have we call the protected time to do what you should do to help the department. So that's kind of the big difference. So because there's a reason there are so many people that want to do the fellowship. For example, if I do ultrasound fellowship, I can be the ultrasound director. So I can focus on ultrasound teaching or education. I don't have to work so many clinical shifts. I can invest my time, to my interest. That will be better. That's why there's more and more people that want to do the fellowship. And sometimes when you want to get in the academic center, they want you have the fellowship training because they want you to do different job, do different contribution to your department. So that's kind of different. I would say it's kind of big difference, between the US and Taiwan, because in Taiwan, the majority of department, they don't really appreciate or emphasize your academic work because they feel like you should do this because everybody's doing this. And they want you to work more because when they need you to fill the spot. That's kind of big difference.
So you're saying that in the US, even if you work in a big medical, like academic center, you're not obligated to having research output every year. You can still focus on your education work and clinical part.
Yes, depending on different settings. So you're right. Sometimes when you are in the academic world, if you are the core faculty and you need to have some research record, but if you are clinical faculty, you don't. And then there are a lot of I'm talking about emerging medicine. I'm not talking about other specialty. For the emerging medicine, if you are a clinical faculty, they don't care about if you have research or not. And then that makes sense because we need people to take care of patient. Why I need people to do research? Like if I want them to take care of patient. So just give it an idea because there are so many emerging medicine physician. They can make like $500,000 just by doing the clinical work. So you don't have to you have to research, you have to education, you don't have to. But in the higher university hospital, yes, they may want you to join the conference sometimes. They want you to teach sometimes because they want you to share your clinical experience with their student. So they do have it's kind of obligation, just like you have to teach sometime. But that is not a big commitment. I think the big commitment is you have to spend 50, 60 hours a month, on the research or on the education part. That is a big difference. And if that is the case, if you are the either core faculty or you are the leadership, and then they will give you the protected time. And that is very similar to any other country, I think. But I think in the US, because this is my time, and then this is my knowledge, and then that's my contribution. I need to get the good compensation for that. That's kind of the big thing. Yeah.
So you can make the same amount of money if you decided to shift more of your hours to education or research?
I would say if we talk about money, that would be very, very complicated. When I say complicated, is like because of big variation. For example, I know that there are a lot of good researchers. They got their salary from the hospital. They got a grant. They even have the money from different pharmaceutical company. So they can make a lot. And then some professor from Harvard or Stanford, they may have a lot of money from lots of like, you are giving a lecture, you are giving whatever stuff, the keynote speaker, you make a lot of money from there. So I would say there's a different career type. And what I try to let people know, just like, yeah, so when in the US, everything is very like depending on like what can you contribute and what you can negotiate with your hospital or your department. So for example, like when I was negotiate, when I was talking to my department, I would say, okay, so I need this hour to do my research. I need this hour to my education. So I need an hour for that, and then they give to me because they see my record, and then they like to they want to give it to me, and then because I have time for that, so I have extra time to do my part-time job, right? So I told you I kind of pick out some part-time job from the freestanding ER, whatever stuff. And then I can still have my main salary, and I have my psychic salary. Some people, they are doing the same thing. They will say, I have my main salary from here, but I have the extra time. I can start investing my second like job. So it depends. Research, yes, research, education. There are so many opportunity. Some people get a whatever like YouTube. They start their different teaching program on YouTube or teaching program, podcast. They can make money from there. I think you can Google it. Like MRAP is a very successful teaching program. Or like I think you probably know like White Coat Investor. This is a totally different thing. Just like they kind of start a company, they make a lot of money from there. About the physician finance. So it's kind of so many things in the US, just like you can do. It's not just the medicine. So it's not just like, I'm sorry, it's not just the clinical work in the hospital. So you have plenty of like, doctor, they make million, just from different job opportunity.
I'm also curious about the moonlighting because you said now you work at different hospitals, right? You have contracts with them. Are you only allowed to do that once you become attending physicians, or you can do that during residency? Like, what's the rule of that?
I think when you are just a resident, basically you are not board certified. So basically, unless you are the chief resident, and then you can do some moonlighting under some, I cannot say supervision, but under some contract, you can. But in general, from the IMG standpoint, usually you may not be able to do the moonlighting. Just because you don't have the license, like yet. So it's a little bit complicated about state license, by the way. There's a criteria for that. But either way, I would say yes. For the third year resident, some people can start the moonlighting if their department allow it. Become attending, of course, is easier. You can do whatever you want. You can sign a contract with one company. If they allow, you can sign another contract with different company. You can do full-time, part-time. We call it PRN. PRN is more like as needed. So you can work like different hospital. So depending on your scheduling. Sometimes when you are in the university hospital, like UT Southwestern or maybe Harvard or Stanford, they may have different policy. So you may not be able to work outside the facility because they have their own facility they want you to work at. Whatever stuff, just like different hospital, different group, different facility, they have different rule. But in general, you can sign a contract, you can negotiate with them, and then you can work more than one facility to balance your life, to balance your experience, and then to balance your income.
Great. There's another question from the audience that says, if you were the emergency department director, which changes or metrics will you prioritize to improve patient care?
It's a very it's a big question because I would say it's a lot. It's a lot. If you really know about emergency medicine, there are so many things. Okay. For example, you have to think about you really talk about the quality. We have the quality metrics. There's so many detail. For example, we have the metrics about what we call a door to doctor time. Everybody have a door to doctor time, and every month you can have your record, like what is your door to doctor time? What's the percentage you order CAT scan? What's the percentage you complete your sepsis? You know sepsis, right? Or sepsis bundle. And then what's the percentage you discharge the low risk chest pain? And how many patient you saw? How many patient per hour? Or what's the length of stay from each patient? Because everything counts. You know, they want you to see more patient. They want you to dispose your patient because they don't want you to just like him there doing nothing. They want you to, you know, just make the plan for the patient. They don't want you to order too many tests. They don't want you to order too many CAT scan. They want you to follow the guideline. There's so many detail, and in our department we have like so many metrics to define if you are the good doctor, and they have the metric standard for the personal. They have the metric standard for the whole department. If you cannot meet your standard individually, you cannot get a bonus. If you can, as a whole department, if your department cannot have the standard, the whole department may not have the bonus. So if everybody want to have the bonus, you have to meet the standard. And every years there will be the discussion between the department and the hospital about your metrics.
So it'll affect your paycheck?
Say again?
Did you say that that will affect your paycheck if you didn't reach the standard?
So usually it's not like you make less money, just like they will delay to give you the money. Because usually you have the certain amount of money every month. It's kind of your monthly salary, but you also have the bonus, like, you know, like it's kind of bonus. Like if you see more patient, you got more bonus, like, you know, every month. But if you cannot meet the if you cannot meet the standard, they will say, you know what, we probably will hold off until you improve, and then we can give the money. So that's kind of what they say. Honestly, I didn't calculate. I don't know. You know, they may not. They may not give me the money, but I'm just let you know. So they have the metric to give you the idea, just like you have to meet the standard. That's why, you know, I have to look at my metrics to make sure I meet the standard. And usually that's not that hard, you know. So you just have to realize, just like if you are not good enough, if you didn't meet the metrics, and then you may get fired because, you know, you are not the good doctor, you know, you are not a good fit to this department. So that's kind of something interesting. In Taiwan, I think they have similar thing, but they may not affect your salary. They may not affect your position. So in Taiwan, I think usually they may have just the discussion between the department and the hospital. But in the US, because it's kind of tied with your salary, it's kind of tied with your performance and your position. That's why everybody's kind of very, I would say everybody's kind of very serious about that.
That's cool. Another question from the audience. We might have touched on it already, but would you mind give a walkthrough of your visa transition? And do you think the Trump administration nowadays would, like, under this political climate, would significantly change the policies for foreign physicians to come to the US?
First thing, I'm a little bit different because I got lots of research. That's why I applied for my green card through we call the NIW. yeah, national interest waiver. I got EB2. I think a lot of people knows about that. And usually if you are the doctor and then if you have a good amount of research, your citation is more than like 200 or 250, and then you got a good like connection. It's not that hard to get approved. I know there are so many people, even the medical student, they have a good amount of publication. They apply and they got approved. So that is relatively easier.
Did you apply for that while you're still in Taiwan? Because you said you got a H1 visa for a research fellowship, right?
I applied when I got matched. So I applied when I was a resident in the US. So because it takes time. So because I think you mentioned a good point. So right now, because there's so many people applying, and then maybe because Trump, so I think you have to wait maybe, I don't know, maybe 2 years, even more, to get approved. So it's not that easy anymore. And then I think it takes more time. So if you want to get matched, if you want to have the green card before you match, basically you have to understand that could be the time-consuming process. So if you can get matched, if you can get either H1B or J1 visa, and then you can apply for that, I think that should be easier because you are in the US already, so it's not a big deal. Even you take 3 years or 3 years, you're still within your residency. You just have to get the green card before your fellowship or before your like I would say before you graduate. So I think that is definitely doable. So I would say it's very hard to predict like how hard would that be, because Trump, you never know. I would say yes, I think Trump he's not very like immigrant friendly, so it's a little bit hard. But I think what we do is we just follow the formal rules, like the policy. You can definitely apply for the green card, throughout your NIW. And I still think that should be doable. For H1 or J1, I still think that should be okay, but you just have to check the most recent, policy. Yeah.
Okay, here's an extra question. I believe it's from an ER nurse. She asked that what's the essential skills and personality traits for a competent ER nurse? Second, what's the most common reasons of them resigning? And three is how AI might reshape emergency medicine's workflows.
I cannot say I know a lot about like the ER nurses, but I have to say I really appreciate the sacrifice or service from the Taiwanese ER nurses, because I feel like they are wonderful and they are very hardworking and then help a lot. We have so many very experienced nurses from Taiwan. I think the nurse, I have to say, I think it's very similar to doctor, just like it's a patient care and then it's kind of direct patient care. So it's not just about your medical knowledge, it's about like how you communicate with patient and how you treat your patient. I think our nursing school or even the American nursing school, I think you can definitely get a good like training, from there. The question is like, are you able to like transit to your like clinical work? Sometimes it's not that hard because because it's direct patient care, so that's the hard part. But if you just ask about the job, I would say the training or the qualification, everything is very, very similar. In the US, it's the same thing, of course, compared to Taiwan. I think the US nurse, I think they got higher pay, they got less like clinical burden. But I do know like some people, they choose like different career path, so it's hard to say. But I think the most important thing is it doesn't matter about the doctor or physician assistant or nurse practitioner or the nurse, the RN. I think it's important to respect every specialty. We are the medical professional, and then we try to be professional. And then that's important to respect every professionals. It doesn't matter about, okay, I'm a doctor, you're a nurse, and then we have the hierarchy. I don't think so. I think we have to respect every specialty, from the doctor standpoint, from the patients, from the hospital standpoint, also from patient standpoint. That's important. And AI, honestly, is interesting because I don't have a lot of experience on AI, right? Like in the clinical thing, we have so many research on AI, but I believe the good thing is, I think using AI, we can definitely have the like prediction model, to see what is the best way to predict either the bad clinical outcome, or what is a good, for example, you're charting, you do a documentation, and that's kind of something I think AI can definitely help our physician for the better or quicker diagnosis, or the especially the charting. I think the charting is a big thing in the US. I think AI can help us a lot. Yeah.
Thanks for
Thank
your
you
share.
for the fantastic talk. I have a question about the communication. So we know that the population in the States is usually more diverse than like Taiwan patients, and sometimes we may see like Hispanic patients speaking Spanish, and we may need to use translator. And we know that it takes probably longer to finish a case, but in the EM field, sometimes if there's like some emergent situation, do you have like some tips to quickly seeing their complaints and know what they want you to find the disease? Thank you.
Okay, I think there's a different thing. The first thing is, if the patient is stable, if you want to get more history from the patient, and yes, we do have the translator. We have a phone. They can translate. And if patient is stable, I want to figure out what happened. I can use the service. I'm not worried about that part, because when patient is stable, I have more time. And we have like the good EHR system. You can get the patient prior report, and then you can have the report from EMS, and then you can have so many resources, we call it collateral, to get the information. In the opposite, if patient is not stable, to me, I don't really need to talk too much about like, oh, ask what happened, whatever stuff, because if patient is not stable, basically I just stabilize the patient, and then I don't even need to talk to patient because I know what happened. I don't know how to say that. Just like, for example, if the patient is having, for example, if patient come in with cardiac arrest, there's a cardiac arrest. You just have to do the CPR. You have to do whatever stuff. You have to do it, and then you have to figure out what happened from your algorithm. And then even I don't know what happened, I have to rule out every significant like reversible causes. So I don't really need to talk to the patient or talk to someone. And then sometimes I have to guess. For example, if I see the AV shunt, I think maybe patient is on dialysis. So maybe the reason cardiac arrest from the hyperkalemia, I have to treat it. If I worry about it, I just treat it. If patient got recent surgery, I can see patient got a swelling from the leg. I worry about it could be the deep vein thrombosis, it could be a blood clot. The chance he has pulmonary embolism could be very high. I may want to get an ultrasound. I may have to treat it. So sometimes that is the beauty of emergency medicine, because you don't know. You may not know. You don't have time. You just have to be very proactive to figure it out. And then that is the big difference between different doctor. Just like some doctors say, oh, why you order the CAT scan? Why the patient got dissection? Why the patient got like the stroke? Sometimes it's not about like the history. Sometimes just like you can see it. You don't feel like the patient is good. And then that's something in your mind. And then you try to get more history, yes, when you have time. And then you don't have to get the whole history. You just need to ask the key point, and then you know what to do. That is the big difference between a junior doctor and senior doctor. If you are interested about emergency medicine, I can let you know more. Yeah.
Okay, so there's a question in the chat that says, he's wondering if pursuing a PhD in a similar field in the US would be beneficial, or if it's better to be a research assistant and have more academic output.
I'm sorry, you said pursuing you said PhD?
This audience is asking if doing PhD will be beneficial, or can he or she just do research assistant in the States to get more academic output?
I think the question is like why you want to do PhD, because PhD basically is very time consuming. If you want to do a PhD, when you graduate, basically it's kind of 4 year, 5 year back, like just passed. If you want to do a PhD just for the residency, I would say it just doesn't make sense because unless you are applying for pathology or internal medicine, you have some connection for that. Otherwise, it's very risky. But again, I'm not saying that you cannot do PhD, because if your passion is on research, if your passion is on that, being PhD can open a lot of door for you. So that's important. So you try to think about what some people do PhD because they really like this, and then they want to pursue whatever like the field, the knowledge about that. Of course, they can have the very good success, and then they can be whatever medical director from like the pharmaceutical company, or they can even be the doctor because they are just so well known about their research. So you never know. But if you do PhD, like I don't really like it. I just want to have the publication. I want to do PhD to enhance my CV and the application. I would say just it's a little bit more time consuming than you thought. So you may have to think about that. And then it's not just about money and time. So some people just do MPH, Master of Public Health. It's kind of just like, okay, I don't want to do PhD, but I do want to have something. They do that. There's a pros and cons. It's a little bit complicated. But I think the bottom line is like what you really want to do. If you want to do if you want to be the physician scientist, and then you like it, you like the life, you like this, of course PhD is reasonable. Otherwise, I would say you have to rethink about what's your career goal.
Totally agree. Pathology is the only specialty so far that I know that a PhD will actually help a lot for matching. For other specialties, maybe biology is a bigger factor. Yeah, so pathology programs don't look at biology that heavily as other like clinical heavy specialties like ER and internal medicine. I'm not an expert on that.
But I think the year of graduation, why they look at the year of graduation, because first they want to know like if you are still teachable. Because if you are the physician already, and then you are the attending already, you may not be able to embrace the new knowledge or new teaching from someone younger than you. So this just doesn't make sense, right? Okay, so you may cause more trouble because you feel like, I'm older than you, or I got more experience than you, and then why I have to listen to your teaching. So that's why they don't like the people like have the like high like year of graduation, because they may not think you are teachable. They may not think you are humble enough. And the second thing is they want to know why you have the high year of graduation, YOG, because you may pursue something else. So if you pursue something else, why you come back? Just like they have so many questions about like the gap. So that's kind of something they don't like. But if you can prove that, I did this because XYZ, or I did this, and then I really like this, whatever stuff, they understand, and then they appreciate that, and they will not be the problem. But the big problem is usually you'll get screened out, from the first, like screening process from the program coordinator.
Okay, there's another question from Chad, who's a fourth year medical student. So according to the match statistics this year, EM has become more and more competitive compared to the last couple of years. What are the possible reasons for that? And second is that would getting a sub internship in as a USCE more valuable than a typical USCE, I guess? Yes, as a fifth or sixth year medical student from Taiwan, do you think we might have the necessary skills to perform well?
I think EM residency, because There was an article from Annals of Emergency Medicine that can talk about the workforce of emergency medicine in the U.S. That's why people kind of worry about I may not have a job when I graduate. That's why people kind of worry about it. That's why in the past few years, I think the match number you can see there are so many spots like on field. But I think people kind of understand just like there are so many. I would say there are so many bias from the articles, and then people kind of understand it's not the case. So I would say EM is a very interesting like specialty, like up and down. So now just like people kind of start coming back, and then I would say this year it's kind of go back to normal. Just like I don't know, just like Trump, it's kind of up and down. In the end, just like everything will go back to normal maybe. So I'm not really worried about that. But in general, I think EM is competitive. But I think EM focus on the clinical practice, clinical experience. So if you do want to apply for EM, I think that's very important. Sub-intern, we call Sabai. Sabai is very, very important. If you can have Sabai to basically just try to get it, that would be much better than other like observership, because Sabai you can actually see the patient, you can put the order in, and then you can actually take care of a patient with doing procedure. That is a very good experience. So I would say if you have the opportunity, of course, that will be the most important thing for you in your application.
Great. Another question from the chat is, I believe he's a fresh graduate, and he asked what key areas should he be focusing on besides step 1, step 2 USC during his 2-year PGY training in Taiwan, if he plans to match after PGY training.
I think right now, because the step 1 they don't do score, they just do like pass and fail. So you just have to pass the step 1. I hope it's easier. And the step 2, you just have to get a very good score. If you talk about your step score, and then basically just your clinical practice, because I would say if you want to like come to the US, because there'll be so many barrier, right? Cultural barrier, language barrier. So especially language barrier. If you are a very, very good medical student or physician in Taiwan, but you cannot have the good either spoken English, or the good in general, like the good English like ability, I would say definitely will limit your performance. So I think it's very important to improve your English, and then to improve your like I would say even the knowledge about the US culture. That's kind of important. That's kind of the most important thing to me, I would say. I think the question you asked before, I didn't answer, just like do you think our student can like shine or stand out in the US as a Sabai? I would say you need to work hard, very hard. The reason is right now there are so many medical students in the US. They start to come to, I think they start their clinical like training since they are the first year. So if you talk about the 3rd or 4th year, I'm talking about US. Basically, there are lots of people, they are very, very good about that already. So, but for you, because again, I'm a little bit too old for that, but usually when we have the 7-year or 6-year curriculum, your first 5 years or 4 years basically is more like your medical knowledge thing. And then you kind of start entering your hospital when you are maybe 5th year or 6th year or 7 years. So just because of curriculum, you are a little bit late, and then you are maybe like 1 year, 2 year behind comparing to other like US like medical student. So that'll be a little bit I would say that'll be the gap. So I've been talking to like different like medical graduate from Taiwan. I feel like their medical knowledge about the medicine is not that strong. So that's kind of something because you have to, so being a doctor is important. You have to learn from the patient. You have to learn from your clinical practice. It's not just a reading textbook. So that'll be the big thing. So if you are interested about EM, you have to start early. Either use your summer or winter or whatever stuff. Use your resources to get more from there. It's not just like follow your curriculum. I can guarantee you, you follow your school curriculum, you can be the average student for sure. You can have the basic stuff, but if you want to stand out in the foreign country, I think that will be a little bit hard.
Thank you, Eric. I think that will be all for today's webinar. So, if any one of y'all has any other questions, feel free to contact Eric. Eric has his Facebook page called the Dr. Eric Chou, the road of the U.S. medical ER doctors. So, yeah, thank you for thanks.
有明显的进步。那另外在医疗的这个部分呢，其实船公司的很多其实都有配合一些员。
It's our utmost pleasure to have Eric tonight, and thanks for everyone who attend this webinar. Yep, I guess that'll be all.
Okay, thank you guys.
Thank you.
Thank you.